Hello, this is Varsha Sharad and I'm a speech language pathologist at Lorem. Today we're going to focus on the management of transgender voice. So initially developing voice and then the voice therapeutic practices we have seen across the country is different when we see for an adult, for a pediatric population, for a geriatric population. Now we come to transgender voice. Transgender, that is when the gender identity or the gender expression is different from that of the gender or the sex they have been assigned to by birth. Most of these individuals have a desire to undergo transition in order to be accepted by the society. So these transitions involve gender reassignment surgeries, hormonal therapies, or a voice and communication rehabilitation. Mostly we see laryngologists and speech language therapists involved in this process, and they influence the communication behavior of patients generally. Acquiring sex-appropriate voice is very crucial to be a part of the society, to be accepted as the gender they identify themselves as. So it's very necessary for us as a speech language pathologist to work with them in order to help them be integrated into the community. So there are different aspects that we need to work. Earlier researchers suggested that working only on the fundamental frequency, that is the pitch range, is necessary. But recently research suggests that along with the pitch range, we also need to work with the resonance, the language, their articulation and speech rate, the non-verbal communication, and also the vegetative functions. So for an ideal male and female in our society, we consider the fundamental frequency ranges. So for in cases of male, the speaker has to have about 100 to 105 Hz fundamental frequency. For a female, we have about a range of 160 to 180 Hz. So this is considered normal according to the society, and the transgender population who wants a transformation in their voice actually are looking forward to having a voice range between these normatives. So considering trans men who have a desire to have a male voice from that of a female voice usually want to lower their pitch, that is to lower the pitch naturally and also to stabilize the same. So in these cases, first initially we start with administering androgen hormones therapy, so where they can have a lowering of their pitch. The second thing is there are several aspects that define us from being a male speaker or a female speaker. The first one is the resonance, where we see that most of chest resonance is seen in male population, and also the articulation speed is much more faster and they don't have any exaggerated body language. All of these things are seen during a therapeutic process when we are providing therapy to a transgender patient. When it's a female client, that is when the therapy is being provided to a trans woman, we have few considerations that must be taken into account. So the first thing is that they want their pitch range or the fundamental frequency to be increased to that of 160 or 180 Hz. So in this process, not always do we provide them with non-surgical methods. In case there is no success for a non-surgical method, we do go for a surgical replacement. So here we have a cricothyroid surgery that takes place, where there is a surgical approximation done in order to get the desired pitch range. And there are several other attributes starting from non-verbal communication, where they have eye contact, the hand gestures, the way they need to maintain their body language when it's female, the responses are more exaggerated. All of these things are taken into account when a speech language pathologist works with a transgender client. Now, except for these non-verbal communication modes and voice, they also work in enlightening the client about the vocal hygiene tips that they must be following. The first thing is that vocal abuse is common among the transgender patients. It's mostly because in order to get integrated in the community, to be accepted as normal, they try to modulate their voice in order to suit the particular gender. In case they identify themselves as males, they want to have a lower pitch. So they start experimenting with their voice, resulting in vocal abuse. As a speech language pathologist, we can enlighten them about the vocal abuse and also give them vocal hygiene tips. So apart from verbal communication, we also have some natural things like coughing, laughing, and also the body positioning. All of these are trained by the end of the therapy sessions. So it's all about bringing a difference to the voice rather than considering it to be a disorder as such. So when we work with such clients, our primary focus is to make sure that the client learns to So when working with the transgender population, it's all about viewing it as a challenge or seeing it as a vocal behavior rather than seeing it as a voice disorder as such. So the second thing is that when we are working with them, we focus more on how they behave and how they want to express themselves in the particular gender rather than seeing what is socially normal. Here we not only help them find a voice congruent to their identity, but also help them and prepare them in order to face the society, the negative responses that they would get from the society. So in case of any other doubts or queries, please do comment below in the box. Thank you.